morning, everyone. Thank you so much for joining us here today. My name is Kristyn Hodgdon. I am co-founder and chief creative officer at Rescripted. We are a media and consumer intelligence platform covering everything from periods and fertility to pregnancy and perimenopause. So thank you, Catherine. That was a perfect segue. So I was 28 years old, college educated, married, sitting in a fertility clinic waiting room before I realized that you had to actually ovulate to get pregnant. Can you raise your hand if you've had that kind of women's health experience at any point in your life? Where you kind of were sitting there and hindsight was 2020 and you wish someone had told you something a lot sooner. I think we all have been there. So that's what this panel is all about. It's about owning your health and advocating for yourself and really getting that power back. So I would love for everyone up here to introduce yourselves. Hi, ladies. Dr. Hsieh.
So my name is Helen Hsieh. I'm the medical director and the founder of Vibrance 360. I have been a OBGYN for the last 28 years. I have delivered about 10,000 babies. And I, and I'm actually one of the early adopter of Da Vinci robotic surgery as well, in Flushing, New York. So throughout my careers, I've helped countless women from pre-teen, teenage, college, getting married, having children, having family, and then going into perimenopause, menopause, and see them throughout their life journey. So right now, I actually, instead of delivering more babies, I no longer do that, and doing surgery, I don't no longer do that either. Now I have founded Vibrance 360, which is a 7,200 square feet full of very innovative devices to help men and women. We don't want to discriminate men. We help them to be able to live to their fullest in terms of their health. And we wanted to increase their health span and not just their lifespan. Thank you.
Amazing. Lovely to meet you. Hi, my name is Linda. I'm a family nurse practitioner, and my clinic is in Jericho Turnpike in New Hyde Park. So I specialize in regenerative health and wellness medicine. I was a nurse for many years, and like Dr. Helen said, I kind of stepped away from that general medicine and traditional way of thinking. So we focus on health and wellness, really helping men and women look and feel their best, making sure your health is at your optimal, where again, you feel your best and it's not just fine because it looks good on your labs or on the paper. So, yeah.
My name is Dr. Mary Vandegrift. I'm a board certified plastic and reconstructive surgeon. My practice is in Long Island, is in Huntington on Long Island. I have been in practice for 10 years. My first 5 years I was employed, and then I went out on my own. So I'm just celebrating 5 years in solo private practice. I treat my patients, predominantly women, although I do see women, men and children as well, but I like to think of myself as more of a holistic plastic surgeon. I do a little bit of weight loss. I do my own injectables. And then obviously I'm a surgeon. So breast reductions, mommy makeovers, the whole gamut, facelifts. And I think that, it's really important for women to take charge of, how being confident in how they feel. And for that means something different for everybody. So there's no one size fits all in my practice. I really want to hear what your motivations are and what you're hoping to achieve, and we work together to make that happen for you.
Good morning. So inspiring to be in a room of so many beautiful and aspiring and inspiring women. My name is Elly Rozengurtel, and I am a doctor of physical therapy, and I am an esthetician. And what I do is functional aesthetics. I'm in a position where I can blend the two. I have been a physical therapist for over 20 years. In the last 5-6 years, I have been thrust into the field of aesthetics. I really have been thrust. And it was a little challenging for me until I realized how much being an esthetician and helping people through their skin challenges is very similar to being a physical therapist and helping people with their function. And at the same time, once I learned, and I'm now a certified manual lymphatic drainage therapist. So once I've combined the therapy and aesthetics, I feel like it's the most important kind of body organs that we neglect. So I concentrate on function and well-being.
Amazing. Thank you, ladies. So, such talented women. Honored to be with you all today. So, I just told you my waiting room story, and there's no denying that sex ed did us all wrong. So, I'd love for each of you to take us back to your own hindsight is 2020 moment. Where were you? What did the doctor say? And what's one thing you wish someone had told you instead, Dr. Hsieh?
Well, when I was thinking about this question, I actually got pretty emotional, so hopefully I can hold it down. um, Actually, it wasn't for me. It was when I was a little girl waiting in the waiting room with my mom. Growing up in a Chinese culture, Asian culture, um, females were looked at as nobody, and you know, my I'm the first. Well, my father's the firstborn, and I'm the firstborn, and I'm a girl, and so it was very difficult for my mom because she has the pressure and the stress to have a son, and she suffered from multiple miscarriages. And I remember the last one, I must be when I was 7 years old, and I could just see her face, her sadness, her stress, and her pressure for losing the child again. But I didn't at that time know the medical background, but all I could see was her sadness. And so I think that planted a seed in my life to wanting to help women. And as I became a doctor, I chose the career of OBGYN. And I think that has a lot to do with it because I feel like I wanted to be able to help everyone that is very similar to my mother's situation and help them to get through not only their physical illness, their physical issue, but their emotional aspect, and that nobody took care of her from. So I wish that, when she was there that day, someone had touched her, somebody had hugged her, somebody had said it was okay, and that she did not need to define herself as someone who has a son, but she has a beautiful life and she's a beautiful person.
Thank you for sharing that. Thank you for sharing that. Linda?
So for me, I feel like that 2020 hindsight moment came as a mom of five from the culture I come from. At the time I had two part-time jobs as an RN. I was in NP school, and like, who takes the time to think yourself, right? To stop for a second and think about yourself. We are taught as women to always take care of everyone else, to be the caretakers, the nurturers, especially, again, the culture I come from. Our grandmothers, our mothers, they taught us to always give of yourself. That's just a woman's role. You wear so many hats and you just don't stop. You don't take the time to listen to your body. And so that took a toll on me, doing all those things. I ended up literally in the emergency room, and I'm feeling all these weird things: fatigue, brain fog, anxiety. But my body is just reacting in such a severe way that I don't even know how to label all these things I'm feeling. So I come out of the hospital, my discharge papers say fatigue. And I'm like, there's no way I'm in the emergency room for fatigue. Like there has to be something more, you know? So I go to my primary. Of course, they do basic panel of labs, which tells you nothing. But on the labs, it looks great. So he's like, hey, you're fine. Everything's normal. Whatever you're feeling, it's normal. So, I start to advocate for myself, try to have my voice heard. And I didn't know who to turn to. But at the time, I was lucky enough to have a colleague from Arizona who was working with a holistic, doctor. And I confided in her. And she helped me get like a full, extensive workup, okay, my labs. And sure enough, my hormones are not balanced. Everything I'm feeling is coming from my low testosterone levels, my vitamin deficiencies, and I had to take care of that. I finally had to stop, listen to my body, get myself balanced. And, you don't have to accept the fact that feeling tired, feeling burnt out, all these symptoms of perimenopause, it's normal. It's part of aging. While that may be so, there are ways to, change that and fix that and for you to feel your best at every stage of being a woman. So once I got myself in order, I knew that this is what I wanted to be doing. I wanted to educate women. I wanted to be in a position where I can help them and show them there's more to just your basic labs and how you look on paper. You have to match those numbers to your symptoms. Feeling fine is not the same as feeling your optimal best. Okay. So that's what we do at our clinic. And I really, I'm happy that I'm able to first have that done for myself and now can help other men and women as well. But here we're focused on the women. And, if you look back to how our grandmothers and our mothers looked at our age, this is not what you saw, like a bunch of beautiful women, self-care and prioritizing their health because all they did was take care of everyone else. And so I love that we're moving into a new era where women are putting themselves first. And yeah, prevention is just as important as treatment. So let's focus on that. Thank you.
Love it. Good for you for advocating for yourself. Dr. Vandegrift?
I had a similar experience going to the GYN. It was about 3 years ago. I was divorced. I was starting a new relationship, and things weren't working the way they used to. And my doctor told me everything's fine. You're going to be fine. This is going to work itself out. And it wasn't working itself out. I didn't recognize myself. I was irritable. I was tired. And I thought, this can't be it. This can't be. I'm only 44. And this was a little bit before this, perimenopause wave that's kind of taken over. So I did a lot of deep diving, and I wound up actually taking a menopause course with a young GYN who was new in practice. And I realized that, there was a lot of information that a lot of women, if I didn't know this, and I went through medical school, and no, we did not learn about menopause in medical school. If I don't know about these things, and how are the average person, how are they going to learn about these things? And so that actually became part of my education. You come to me for a tummy tuck, I can make your abdomen flat and you look awesome. But if you still feel like crap on the inside, like that, you're not going to have a good outcome. Right. And so a lot of what I do when I talk to my patients about what their goals are, I also kind of get into, how do you feel? Are you taking the right, supplements? Are you seeing a doctor who is maybe evaluating you whether or not you should be on hormones or not? It's all part of the wellness and getting you to a place where you feel good on the inside and the outside.
I love that so much because I think, there's this whole like Western medicine versus like the holistic side. And I think there's a world where the two can coexist in a way that patients feel seen and heard. Elly?
So I am going to kind of resonate with Linda a little bit. We do come from same culture, and there's a lot of pressure and a lot of expectations from being a woman. Definitely a mother, a sister, first of all, a daughter, and Then you become a wife, and you're also supposed to work, and you're supposed to get your education and do everything at the same time and host, right? um, so my hindsight 2020 was when all of this was kind of coming together. I was in, I was getting my doctorate. My husband was getting his master's. We had 3 little children, both working full time, 2 jobs at some point. but and you also want to look good, right? Because with all that comes the fact that you don't have time for yourself. You don't have time for a healthy meal. You don't have time to have a good sleep. You don't have, right? I mean, we can all relate to this. So at some point, you're looking for quick and easy ways out, and weight loss this and weight loss that. This was before GLP-1s were even out on the market, and I ended up losing weight very quickly. I loved the way I looked. I didn't realize it was going to hinder my health. So I also found myself in an emergency room with digestive and gallbladder issues. And that kind of made me, first of all, stop and think about um, how we view ourselves. We're always looking for, keeping up with the Joneses. Is that the phrase? We have to. She looks great. What is she doing? I want to do the same thing. And it's really not about that, because you have to show up healthy and happy for your family and for yourself. And there's no one's going to make you happy. It's just you. You're the only person who can make yourself happy. Thankfully, all that was taken care of, but it left me with a feeling that not everything has to be done quick. And therefore, when we're treating in the clinic, this is kind of the approach we have as well. It took you so long to get to a point where you are, whether it's unfortunate weight gain, which is now we all know is very much hormonal, whether it's skin issues where your pigmentation, laxity, or congestion, that all took time. You can't expect it all to be gone overnight, unless Dr. Vandegrift does her magic. But even that, as we know, has recovery, right? So surgery has recovery time. So just giving yourself time and allowing yourself to be well and be happy. I think that's kind of my hindsight.
Amazing. Thank you so much for sharing. So that's actually a great transition. So I see this all the time on social media. There's so much pressure to not age gracefully, look your best, lose weight, don't lose weight, embrace your body. Like there's 9 million different messages coming at you at every hour of every day. So there's so much pressure on women to make decisions about their bodies based on what everyone else wants or what they think they should look like. How do you help your patient separate what she actually wants from what she's been told to want?
So basically, I I ask my patients this question. It's not what you want, it's actually what you want to feel. You want to feel more energetic. People always ask me this question: why am I so tired? Why am I so fatigued? Why don't I have energy? Why don't want to have sex with my husband anymore? That's like the question that I get all the time, and it's not it's not something that it's really more personal. It's not what people ask you what you should be. It's actually what you really want to see yourself. And you want to see yes, everyone wants to see themselves more beautiful. Everyone wants to see themselves more confident. But can you do that? And how can you do that? And it's actually very, very both mental and physical. So I do a lot of vaginal rejuvenation treatments for patients, and I think that is so important for women because if they're not confident at home and being able to be intimate with their husband and feel the pleasure from that, it actually portrays throughout whatever they're doing in their career, in their friendship, in their um, just well-being. And I think that that is so important. So, but too many women don't even want to talk about it. Too many women don't even want to admit that they have a problem. And I don't want to see that as a problem, but something that we can help you to get through. And there's so many technology, there's hormonal treatments, there's technologies that, ways we can help you with. And so please, ask and seek help if you need it.
Love that. Linda?
So every treatment for my patient starts with a conversation in the consultation room. So, we talk about, like Dr. Helen said, how do you want to feel? How do you want to look? Whether it's aesthetics or wellness, we discuss and try to put together a treatment plan that's going to create the goals that align with, how you want to perceive yourself. And I always, my job is to educate the patient. I feel like an informed patient will always, do what's right for them, and they'll know what's right for them once they, have the answers to certain questions. And they won't like feel the pressure to do something for social media or for their family or for, anyone else. So I really also love to get personal with my patients. Like Dr. Helen said, a lot of women, they don't want to talk about what they're going through, right? Especially when it comes to intimacy. I open up to my patients. I talk to them about me and what I go through and the treatments I do and how I feel. And, then they start to feel safe and open up to me. And we're able to do what's right and personalized for each one of them.
I agree. A lot of it is education. I mean, when I was in training, a young woman came in for a Botox appointment with my mentor, and he left the room to go get the Botox. And she looks at me and she goes, "I'm only here because my friends told me they wouldn't hang out with me anymore if I didn't get Botox. They couldn't stand looking at the lines on my forehead." And I looked at her, and I probably spoke at a line, but I said, "I think you need new friends. I mean." Nobody should be telling you what you should be getting. But there's lots of advertising out there, and I have a slew of patients that come in and say, I want the minimally invasive or the mini facelift, or I want this skin tightening device. And a lot of it's just education. If you've lost 100 pounds, a minimally invasive skin device is probably not going to be the best way to address your skin, right? And so that's just a conversation. It's just education. And it's just empowering patients to advocate for what they want. And and going back to that poor young woman about the Botox, and we talked, and I said, you don't have to get Botox if you don't, and she said, my lines don't bother me, but actually this does. And then we talked about what, maybe that was her entryway to get into the office, about what really bothered her. And it's also just listening to your patients and giving them space to talk about, what they need from you and what you can give them.
Yeah, I also think there's like a mental load associated with wellness culture. And like, if something isn't important to you, like, why are you even adding it to your plate? Like, I think like we need to give women permission to not do everything, even if it's like a biohacking thing or a wellness thing or a self care thing. Like, if it's stressing you out to do the self care, it's not self care.
Yeah, exactly.
Elly?
Definitely concur with everyone here. When we do have a lot of male clients, but definitely the majority of people seeking um, aestheticians advice are women, and the men who come to us are usually because they were referred by their women in the circle. Um, and they will come, and it's because of a trend they saw on Instagram, because of what their mother-in-law said, because of what their friends said that they're doing. And the question is, why are you doing this? What is this for? What are you looking to achieve? And a lot of times, myself, I have to look at their overall, and everyone as a provider, we look overall at what they're actually needing. In my case, is this sluggishness they're feeling, is this a result of some sort of maybe lymphatic backup? So is the skin being is the skin producing more pigmentation because of hormonal imbalance? Right now, we know that melasma is highly related to hormonal imbalances. Um, so a lot of this stuff is definitely, and we have a consultation, we have facial scans, we have all this that we do to help our clients be educated, and on top of that, give specific treatments that work for what they're looking for, because a lot of times they just know of a treatment, but they don't know what it does.
Mhm.
And a lot of times they come in and they said they've had a treatment done, and I said, why? That always boggles my mind, because it wasn't meant for you. I feel terrible that your provider put you through this, because it wasn't necessary. But a lot of education, and a lot of times it's um, my answer is usually, you are really beautiful the way you are, and you have to understand that first and foremost, because your self-awareness and your self-worth and your self-respect comes only from you. No, yes, I definitely think that when you look great, you feel great, but you have to know that, because a lot of times it's not enough. You're going to keep doing things and doing things and doing things, and you're never going to feel happy. So you're the only one who can make yourself happy.
Yep, it comes from within. So we have less than a minute left. Rapid fire, one sentence each. What's one belief about women's health you'd love to permanently retire? Mine is that debilitatingly heavy and painful periods are just part of being a woman. Dr. Hsieh.
Um, Aging is inevitable. Aging, you're just aging. I don't really like to hear that word, because I don't want to feel like I'm aging. I actually want to feel like I'm living younger and younger every day. And because with all the things that we can do now to help ourselves, we can do that. And I hope I will be the testament to that. Thank you.
That feeling burnt out, tired, and you're just getting older is normal. Women deserve to feel their absolute best at every stage in your life.
That being a woman equals some form of suffering. We shouldn't have a baseline level of suffering. And if something bothers you, get answers, get a diagnosis, get treatment. Don't stop until you get an answer.
Aging gracefully is bullshit. Because we have so many tools at our hand right now to look excellent and feel vibrant, that we need to be investing in ourselves.
Love it. And lastly, just want to say, I think we said it numerous times here, but if anything feels off about your body, you know your body better than anyone else. Advocate for yourself, ask the questions, and own your health.
Yes.
Thank you.